everybody, good morning. Thank you so much for joining us. This is Harriet Kamek with Down to Earth. It's our daily podcast and in which a show in which we talk about the issues that matter. And today on our show we're seriously going to talk about emergency rooms and why emergency room doctors are so overworked. I was just like you last night, I was a bit taken aback in reading this article that I came across. And as usual, I'll post the link to the article after the show is over so that for all of us, you can see what it is that is going on in America's emergency rooms. It's the craziest thing ever. Emergency room doctors are overworked. And it's kind of like in the era of the Affordable Care Act, why does this continue to happen? In fact, some of the statistics are quite alarming that the number of people visit the emergency room more frequently than a doctor's office. So we're going to talk about that. And what does this mean for the care, for healthcare, and the delivery of healthcare to all of us? So I just want to say that and thank you so much for tuning in as usual, and to thank you for, as always, being a part of our experience this morning. So my thing is this, why are emergency rooms busy, right? Why are emergency rooms busy? Am I a professional with men? What does that mean? Somebody is asking me if I'm a professional with men. How do you think I should answer people? How do you answer that? Because people don't know what a true emergency is. Don't say that. Don't say that. But there's a deeper reason to it. I agree with that people don't know what a true emergency is, and what might be an emergency for you and I may not constitute an emergency when you go to the ER, right? That's one. Number two, is it that people are just not visiting doctors' offices? I think that's the key. I think people are just not visiting doctors' offices. I think when the Affordable Care Act was passed, it made insurance unaffordable. Because if prior to the Affordable Care Act, if you didn't work and you didn't have insurance provided to you by your employer, you would go on state Medicaid, right? Then the Affordable Care Act came in and you now had to go into a healthcare marketplace to buy insurance at astronomical rates. So if you're working, your insurance, you might be paying $350 per month for health insurance, which is ridiculous. And then it limits how many times you can go to the doctor per year. Most insurances have a limit on how many doctor's visits you can make per year. You can only do one physical, right? But then it limits how many times. So if you have a cold, a flu, or some sort of virus, then you're not really able to make it to the doctor, right? Consequently, people show up in emergency rooms for viruses and common stuff. Okay. But emergency rooms were really designed for mass tragedies like a train crash, a bus crash, an airplane crash. They were designed for accidents, those kinds of things, right? They were designed for major pileups on a freeway, right? That's really what they were designed for. So their treatment modality is such that if you come in, you're up or out. The emergency room sees you, and then they determine if you need to go upstairs to a bed or if you're going to go out for a follow-up at your doctor. The problem is most people do not have a doctor. When I read the story last night, one emergency room physician said that a patient had come in and the patient kept coming in to the emergency room, and because there was no follow-up to the doctor, the patient didn't have a primary care physician. Somehow between the emergency room visit and the patient not being admitted, the patient got lost. So the patient would never receive her asthma medication that she needed. You know, that inhaler thing? She ended up back in the emergency room. By this time, she completely paled out. She died because she did not have health insurance that covered her for doctor's visits. There are a lot of people who are in that gap, who don't have health insurance because the Affordable Care Act has gaps in care that are not being addressed. Worse now, in most states, like here in Michigan, they're now requiring that people who are on state Medicaid must work. And you're looking at people like, what about the people who are bedbound, What about people who have chronic diseases and can't work? What are you going to say to that? So politicians use healthcare as a battering ram. Look at it this way: politicians do not see the big picture. The only big picture that politicians do see is their money, right? Money. So if they're going to make money from the insurance lobby and from the hospitals lobby, then they make money, but they don't see the big picture. The big picture is this: if we do not take care of our population, if our population are not healthy, then we're not a healthy country. If most of our people cannot afford to see the doctor to get the care they need, it means more people are dying from preventable illnesses. Reference the show we did last week on poor healthcare means poor people. The poor delivery of healthcare means that poor people who don't have access to healthcare, means that people are dying from preventable diseases. And we still refer to ourselves as a first world country. Well, we're the only first world country in the world that has such a sucky healthcare system. Our healthcare system is driven by profit. Our healthcare system is not about people and providing care that will take care of its population. Our healthcare system is driven by profit. Who stands to make the most money off the backs of sick people? This is why our healthcare system sucks. This is why more people are dying, even from cancer. People die from cancer because the healthcare system wants to hurriedly give you a diagnosis of cancer, because that means they're going to bill your insurance for more drugs. So they give you drugs that kill you off. Sometimes it's not the cancer that kills you off, it's the drug. It's not the cancer that causes hair loss, it's the radiation in the chemotherapy. They call it chemotherapy, but it's really liquid radiation. Your organs shut down, not because of the cancer, but your organs shut down because of the exposure to radiation. Do you see what I'm saying? Nobody is raising the standard bearer because everybody is afraid to talk. Everybody is afraid that if I say something, they're going to come back at me. If I say something, sucks to be me then, because I do go to the doctor. So what are they going to do? Put stuff up in my veins and shut me down because I'm talking? But we really need an answer. Most people do not have, that's why people go into the hospitals in the emergency room. Sometimes you exhaust your doctor's visits for the year. You call, and the doctors now are not as compliant because they're restricted and mandated by the HMOs that they're a part of. They can only see you, even if your doctor wants to see you, it comes down to the money. If he's not going to get paid for it, and if he can't justify a visit, he's not going to see you, because it comes down to the money. He has to pay fees to the HMO he's a part of. And he has to be compliant because that's how he has privileges at the hospitals. Privileges meaning he goes to the hospital and he's able to see his patients at the hospital while they're there. So hospitals need doctors and doctors need hospitals. So they're in a symbiotic relationship. They're in a very intimate relationship, much to the chagrin of the general public. We become the loser because the hospitals, the doctors, and the insurance companies are all in this thing together. They're all sealing up the stream, and we are downstream. They're sealing up the stream to the glory of money, and we are downstream to sickness, disease, and every wicked thing that can come against your body. So emergency rooms then become everybody's doctor's office. You know, I recognize that maybe I went to the emergency room too frequently when I can jolly well go to the doctor. But in the moment, if you feel funny and you feel like this might require some attention, then you'll go to the doctor, and then they'll say, well, follow up with your primary care. And so you go to the primary care and you follow up, and they have access to your medical records and so on. But when I remember the last time I went into an emergency room, I sat there and I was looking, and I said, why? I said, why are so many people coming into the emergency room? They don't have a visit to the doctor. There was a woman there who hadn't had a period for 8 months. And then she never thought that she was young enough to be pregnant. And then when she started bleeding was when she came to the hospital. And they asked her, why did you not go to the doctor? she doesn't have a doctor to go to. Do you see what I'm saying? I don't know what the outcome of that was. I didn't see her, so I couldn't ask. I just was shocked, right? Because these things happen. And especially in the rural areas, the doctor is perhaps 20 miles over, but the hospital might be closer, right? So people will go into the hospital more than they will go to the doctor, if you can believe such a thing. I am just saying that we have some serious issues that are going on. We really have to look at healthcare. The way it used to work is not the way it's working anymore. When we had healthcare that we could go to the doctor, we were way better. But now it is wrapped up in politics and wrapped up in the delivery of healthcare, wrapped up in the delivery of everything that shouldn't be, that we really don't know where to go and what to do. And so we become a victim. In many ways, I think we've become a victim of our own success, because we have become this thing where we don't know where we are. We've become a kind of like wrapped up in the things that we have done, right? And while it's all well and good and all that stuff, I think in a lot of ways what we have done is we have caused ourselves to be to have some sort of issues. It's not quite the best thing for us to find ourselves in this kind of mode, because when you look at, for a first world country, we have tremendous resources here. We can afford to take care of our population. We really can. We can afford to provide healthcare, at least some form of basic healthcare, where people can go into the doctor if they feel like they have a virus, if they feel like they have a stuff. The ER should be reserved for when you got a cut overnight, or on a weekend when the doctor's office is closed, or during a holiday when doctor's offices close for 2 weeks, they take a whole vacation, right? And in some areas, visits to the emergency room wrap up. Like nationally, in the last year, 140 million visits were made to emergency rooms. That's alarming. You want to ask yourself, that's like more than 1/3 of the population. So you want to ask yourself, so where are the doctors? And you look at doctors and you look at their exorbitant lifestyles and you're like, dang, they're living large. They're living really well. Okay, so they went to medical school, so they're making some serious money. Emergency rooms visits are expensive, right? Ask anybody who has medical debt. Anybody with medical debt? Emergency room visits are expensive. And what they were saying too is that sometimes the doctors in emergency rooms order a lot of unnecessary tests. Well, the truth is, the doctors are trying not to get sued. So they don't know they don't have your history, so they don't know what's going on. So based on your symptoms and what you are describing to them, they're going to order a battery of tests to see if at some point those tests are going to tell them what exactly is wrong with you. And those tests might seem, at the end of it all, it's going to seem like, well, it was unnecessary. But in the heat of the moment, nobody knows. So the doctors order the test to cover themselves from any kind of liability that can eschew from you suing them later on. But that's not our problem. Our problem really is that we have used emergency rooms, especially since 1999. We began seeing the uptick in 2009, where more visits were made to emergency rooms, is because people don't have health insurance. When politicians held their sway, when the Republicans went to bat, they determined that people should not have affordable health care. They determined that that's not something that anybody should have. Let's just be clear about that. Healthcare is wrapped up in politics. And until we separate politics from healthcare, people are going to continue to be sicker and sicker and sicker. Sometimes it makes you wonder if there is a mass agenda behind this. Is there some kind of mass agenda here? Is it some form of population control that people get sick and they go to the emergency room, and in between the emergency room visits they don't have a follow-up to the doctor, so then they're going to die on their next, if they make it to the next visit to the emergency room? Is there some kind of agenda as to control the population by this? Sometimes I look at America and I'm becoming more and more aghast at what I'm looking at, because we're looking more and more like some of the nations we criticize. We're criticizing them for not providing health care to their citizens, but we're not doing the same thing. We're not doing it either. Politicians like to pontificate and get on a pedestal and on a soapbox and talk about what's wrong over in someone else's backyard, but right here, what's going on? Fixed healthcare. People can't afford to go to the doctor. They try to treat their illnesses. For the love of God, there is a virus on the loose in Jamaica. A lot of people go to Jamaica on vacation. It's called a dengue virus. It's killing people. But now they're saying it's more malaria. Frankly, I would have thought that they would have stamped out malaria a while ago. Now, if people who go on vacation come back here and bring that virus here, do you have any idea what that could be like? Makes you want to ask yourself, when was the last time you had a malaria shot? Mine must have been 10 years ago. Do you see where I'm coming from? And people here don't want to get vaccinated. Are you kidding me? Right? Like, seriously? Right? So you have to look at what would happen. Have you seen the movie Contagion? Anybody seen the movie Contagion? No one? Okay. I suggest you go watch that movie, Contagion. I don't know if you can find it on Netflix. I doubt that, because it's been a while since it came out. But go watch that movie, Contagion. It's a warning to all of us. If their politicians don't operate in a vacuum, they have an agenda somewhere, and somehow they're protected because they're in the protected class, right? And I think there is a huge lack of compassion that is guiding a lot of public policy today, where people frankly do not give a care. They don't care about people. They don't care about the advent of their policies, the impact their policies have. It's all about me and how much money I'm going to make, and I can send my kids to this kind of school, and I can buy this for myself, and I make sure I have money in an offshore account so the government doesn't know that I'm taking a bribe on the side. But it is what it is. Emergency room doctors are overworked. Let's just look at that, for instance. A typical emergency room doctor is an overworked person, because in most cases they assign one doctor. You don't see a specialist in the emergency room. There are no specialists. So if you walk in with a traumatic brain injury, they have to call someone on call, because it is designed to be quick. So sometimes it makes you wonder, though, if you are worried about people coming in through large-scale mass events, mass catastrophic events, then why you don't have a specialist on staff, like somebody who is a neurologist? Begs the question. But hospitals don't operate that way. Hospitals operate on the basis of money. It's all about the Benjamins, right? Hospitals operate on the basis of for-profit. What does it mean for me? For-profit. That's how hospitals operate. They don't care about what you and I care about. You go to the emergency room because you feel funny. You might as well just wait it out tonight and make an appointment to go see your doctor tomorrow. Doctors, on the other hand, say, well, my patients make more visits to emergency rooms, but when you go into the doctor, they prod you, they check you, and they write a script just like the emergency room doctor does. The problem is most people are not getting to the doctor because doctors are bound up by these rules and laws. The Affordable Care Act, I think what Obama might have intended was to make healthcare affordable to everyone. The problem was they made so many concessions to Republicans because Republicans did not want the Affordable Care Act passed, because it was going to siphon money away. They promised the hospitals and the HMOs that it wasn't going to work, and the hospital lobby and the HMO lobby is huge. It was not going to be beneficial to a politician's pocket. So they did not want it, and the Republican Party especially did not want the Affordable Care Act passed. Now, the Affordable Care Act was modeled off the then governor of Massachusetts, Mitt Romney, had passed an Affordable Care Act in his state that worked for Massachusetts. What Obama did was take that and say, well, we can bring it national. It looks like it works. Let's do it. I don't know if it had something to do with branding, they called it Obamacare or whatever. It just made people get mad that he would have a legacy. I don't know what it was. But all I know is at the end of the day, the public paid the price for government egos. The public paid the price for the egos of politicians and the egos and the rapaciousness of capitalist investors in healthcare. And we, the public, are losing. People are dying from preventable diseases. We talked about that last week. In some parts of the country, some of these things that people are dying from, COPD, seriously, you need an inhaler for that, right? People are dying from alcoholism that causes cirrhosis of the liver, right? People are dying from drug overdoses because they're not near centers where they can get Narcan. I kid you not. People are dying from heart disease that, if diagnosed by a primary care physician who can prescribe a specific diet and monitor the patient over time, can reduce death, perhaps even prevent untimely death. People are dying from high blood pressure, high cholesterol. These are preventable diseases. We're not talking about stuff like cancer that you obviously, once it hit, God, nearer my God to thee or something like that. But preventable illnesses that, if monitored by a doctor, will prevent prevent fatality. That's not happening. What you find is that people end up walking into emergency rooms just so they can see a doctor. And sometimes you walk out of the emergency room worse than you walk in, because the doctors don't have enough time they go from one patient to the other. I've often asked that. I observe, I'm very observant. So, they touch me, they touch you, and they just go from one to the other. Have they washed their hands? So I tend to look at doctors when they're coming near me, if they wash their hands first. I look pointedly at how they're washing their hands before they touch me, because I know you just touched somebody else who probably had the flu. No, you're going to come and touch my nose, my face. And people are afraid and are intimidated to ask their doctor if they have washed hands. And then they're saying, well, we need to reduce emergency room visits. Yeah, but help the people. So they, in between the emergency room, leave the emergency room for a real emergency. But get them to see a doctor. How? When insurance is prohibitively expensive. What happened here in America? What happened? We just changed. We just became a nation that has no compassion for nobody. We became a nation that is motivated by profits only. But just yesterday we talked about Fashion Nova employing people and paying them $2.77 per hour through middlemen and through third parties. What happened? Right here in LA. So it's not like it's happening in another country. Happening right here. What happened to us? How can someone survive on $2.77 an hour? I think the next people we're going to call out are the restaurant industry, who pays servers a lot less. Why? What have we become? Do you see what I'm saying? We've got to sit down and really take stock, or change out the politicians, since they're all so rapacious and motivated by the bottom line. Vote them all out. Since they're motivated by how much money is going to reside in their offshore accounts, get rid of them. Since you can only be big business to talk to them, get rid of them. Because that's not how the system was designed. Politicians were supposed to be of the people, by the people, for the people. But politicians today are by the business, for the business, of the business. They're not for people. They don't care about the small man. They don't care about me or you. They don't care about our outcome. They don't care if we are broke, if our bodies are mangled. They don't care if we're dying from heart disease. Look at that story I read yesterday. I'm going to post the link. The young woman was 23 years old. She had been going in and out of the ER. All that it was asthma. How can someone die from asthma in America? A young person. Because she didn't have health insurance, so she did not have a primary care physician. So in between, the job of the ER doctor is not to prescribe a follow-up visit. That's not his job. He will suggest that you go see your primary care, but it's not his job to make sure you go in to see the primary care. So when the ER discharged her, she never went to a primary care doctor because she was 23 and couldn't afford health insurance because of her asthma condition. She couldn't work. Guess what happened to her? She died. She came back to the emergency room and just flatlined. She just flatlined right there because she wasn't taking her medication in between. My friends, we got issues. We have lots of issues. We have issues. And the issues, my concern is, if we're not taking care of our population and we're not taking care of our people, then who is going to be around to run the country in 50 years? Where are the people going to be? When people get sick, are they going to say, oh my God, there are a group of people in such and such a zip code and they all are sick. Let's make sure their illnesses don't come over into our area. So let's quarantine them and place soldiers and police or whatever so that they don't come over. Is that where we're headed? And then just give them all the diseases, let them stay over there and rot. Is that where we're headed? We have become so vile and corrupt in our thoughts. We have no compassion one to another. It's every man for himself. And we've been seeing this for some time, and we continue to not do anything about it. The politicians are ripping us off. They're literally ripping our throats out. They don't care, people. They don't care about you and I. You're just a vote. And if they can get you to swing a vote for them, that's all they care about. They don't care if you live or you die. They don't care what happens to you. It's crazy. I just read a disturbing report where a young woman who came from Honduras, she was 19 years old. According to the law, if the baby is born in America, it becomes an American citizen, right? So this young woman gave birth to a baby. They plan to return her to Mexico without her baby. You can't take somebody's child. Where the hell did that come from? So because she's an immigrant, an undocumented immigrant, she's not a person, she doesn't have rights. The baby was born here. They're going to keep the baby here. Who is going to take care of her baby? You're going to kidnap somebody's whole child. Do you see what I'm talking about? That's how we have become. Our hearts are vile and corrupt, one to another. We have removed our humanity and replaced it with money. We've removed our humanity and we've placed the love of goods and luxury goods in exchange for it. The average U.S. congressman or woman earns $178,000 a year. They want an increase. But the factory worker out here had to strike to get more than $15 an hour. This is why I'm saying when it comes election time, y'all need to just look at who you're voting for. And look at them, seriously. Don't just go in and vote. Ask questions, because they're surviving based on your vote. And if after you vote them in and they're in there for 2, 3, 4 years, vote them out. Don't vote for them again if they haven't done anything to change your bottom line. We have a problem with healthcare. People are getting sicker. How can somebody die from diabetes and complications of diabetes in America? And we call ourselves a first world country. So when you look at America, the country is divided. There's the bottom half, and then there's the top half. That's the America that they want you preacher. They don't care about the bottom half. The top half, that's America they're referring to. When they say we don't want that in America, they're talking about themselves. They're not thinking about the bottom half of the country. If they were, Fashion Nova would not be paying somebody $2.77 an hour to sew a garment that people like Cardi B wear. She's a fan. She models for them. There's so many of them who model for them, and they don't care either. All they're thinking about is their bottom line, is the money they're gonna make. It's all about the Benjamins, isn't it? Is that shocking for you? Like, do you feel shocked? Do you feel like, oh my gosh, it's all about the Benjamins at the end of the day? For a politician, it's who is going to put money in his offshore account. So he doesn't even pay taxes on it. So he listens to a lobbyist and he goes to Congress and he says, well, we can't pass this bill, blah, blah, blah. And the lobbyist pays him into his offshore account. No, there's no trace for it. You ever seen a broke politician? One who served and comes out of office and he's broke? Are you kidding me? He does not exist. Look at Barack Obama, for instance. Before Barack Obama became president, he was not even a millionaire. Now the guy's worth $135 million. He only made, what, $400,000 for 8 years as president. So let's say he didn't spend his salary because everything was paid for. And let's say his first book sold. How you go from zero and in 10 years go from zero to $135 million? They get paid. Their money sits somewhere, and then when they come out of office, they put the money and say, well, his wife sold